Good morning, everybody. Welcome to Dental Voice on the Case with Xyrus. My name is Rolando Mia, and we have our founder, inventor of Isolite, Dr. Tom Hirsch, with us today. So, during this episode, what we're going to do is we're going to sit with Dr. Hirsch, and Dr. Tom's going to basically take us through how Isolite enables him to work solo when he needs to, or even when he wants to, while still enhancing his DAs and his practice. A quick stat here, which is absolutely amazing. Dentists are basically saying that 38%, 40% are saying that they're understaffed pre-pandemic and that they're having difficulty finding dental hygienists. So we felt this would be awesome. So good morning, Dr. Hirsch. How are you?
Hey, good morning, Rolando. How are you doing today?
Well, thank you.
I have to tell you something. I hate working by myself. I don't like it. I hate it. I love having my assistant right there. She or he is literally my most valuable asset in my office right now. And like a lot of you right now, I'm understaffed. Understaffed for a variety of reasons. Number one, I've got flight out of California. I have my office manager move to Texas. I had one of my dental hygienists move to Florida. I had another front office person go to Oregon. So we are totally understaffed right now as we start searching for the perfect team. And I have now replaced two of my team, but still we are short staffed. Plus the fact my assistant, her daughter got married. So she says, I'm taking 3 weeks off for the wedding. So boy, does that not come with a high impact right now? I'm so short staffed. I can't even believe it. So anyway, as far as working alone in my office, sometimes I have to do it. Sometimes my assistant is right there by my side, but at least when I have the eyesight, it gives me the flexibility to free up my assistant and say, she'll give me a nod. If we have an emergency that comes in, I'll say, yeah, go take care of that. And I can work comfortably by myself knowing that she's close by if I really need her. So I put together 4 or 5 videos today of stuff that you've seen before. They're just really quick little simple things that just kind of show how I'm working by myself. So first of all, here's number 15. Tight access spot in the mouth, the occlusal of 15. It was a simple little filling to do, but there's not enough room for my dental assistant and my mouth mirror and everything for me to be able to see what we're doing in a tight space. So we get back there, we drill a little, we look a little, and you can see that I'm there by myself while my assistant is either in the room or she's gone off to do something else. These are simple little procedures to do. And the Isolite just allows me to do these procedures quite simply, whether it's on the upper arch or if I'm going down to the lower arch right here, doing a DO. It looks like on number 30, tooth number 30, doing a DO composite. I don't have to fight the tongue. I don't have to sit there and keep the tongue out of the way. I can concentrate on what I'm doing. Especially now my assistant is gone. I'm a one assistant guy right now, and I don't like being a one assistant guy. So even from the simple little fillings to the more complex procedures where I'm doing crown preps and I'm taking crowns off a tooth, which you'll see in just a moment. It's really not. Oh, rubber dam. Here we go. I use rubber dam, and I love rubber dam when it's applicable. When I'm using rubber dam, though, as you can see, these were 8 or 9 or 10 composite fillings, class 3 composites that we're doing. I do them dry because with the rubber dam, I've got to have my assistant there to vacuum everything if there's a lot of water, and it's messy. So with a rubber dam, I've got to have my assistant right there, even though the drilling aspect is really pretty easy and it's pretty clean. If I want to clean things off, I need somebody to catch the water. So it's got to be four-handed dentistry with a rubber dam. But I use this. I love rubber dam. And don't forget, you guys, with rubber dam, you know what? Use it. You learned it in school. You learned it for a reason, and it's quite a valuable asset. Here's another situation where I'm working sans assistant. My assistant is just off in the other room doing something else. Busy day. Prepping 3 crowns. So more of a complex situation when we're prepping crowns. Sitting there sectioning, it looks like 12, 13, 14, or 12, 13, 14 old crowns that had redecayed over time. And so we just sectioned them off. Notice my assistant is not there. And as I pop these things off, I don't worry about anything going down the throat. I don't have to worry about my assistant being in there and having a real issue with somebody gagging or we losing something. See, I just take them off, take them out. I can pick it up all by myself. And see, there's just lots of debris in there that we can go back and we can suction on later on. It's safe. It's a safety situation for a patient. And safety is a big factor because you can be surprised from time to time. In this next procedure, I'm just removing an abutment from an implant and just kind of dried it all off. Whoops, look at that. I got this. You've seen this before, but just the surprise of my life, if I had not had the Isolite in the mouth, that thing would have gone south. It could have gone down the patient's throat or in an airway. It would have been a nightmare. But back to the point, I'm just able to do these things when my assistant is busy doing something else. And you guys should, pick this up as a safety factor and a convenience factor, especially now when we're short-staffed. I rely on the Isolite more and more right now than I ever have, just because of the staffing situations that we've got.
That is amazing. So, first of all, thank you for sharing that. And it is definitely a situation now, especially post-COVID, that there's a lot that still hasn't settled. Now, you shared with me that prior you've come into the office even at night to treat patients. Is that right? Now, do you call your assistants to come in to do that, or what?
No. I truly believe that one of the number one things that you can do for a successful practice is be available for your patients anytime. If they've got a true emergency, or even if it's not a true emergency, in their mind it's an emergency, be available for them so that you can go in and see them late at night. Am I going to call my assistant to come in and assist me at 2 in the morning or 10 at night? No. Or on the weekend? Not usually. Every now and then I will have to, but not usually. I know that I can come in after hours, in the evening, on the weekends, do what I need to do. Certainly not to take my own x-rays and work by myself, knowing that everything is safe, everything's going to be nice and clean, and the tank's going to be out of the way, and I can get the job done. The biggest thing that I hate, or one of the things that I really hate about working by myself, is doing the dishes. So my staff has really been very clear about that. They said, if you're in here on the weekend, just leave it. We'll deal with it when we get there first thing Monday morning, because they know I'm going to put something away in the wrong spot. So, and then we're stuck. We don't know where to find anything. So on the weekends, Rolando, I do. I'm here, not oftentimes, but every now and then we have an emergency. I'm accessible. And because of that, the patients love me, and it's contributed to my success as a clinician.
That is awesome. Also, from a workflow impact, how has this helped you with regard to maintaining, or has it affected the workflow that you currently have in your practice?
Say it again. Say it louder. I got some stuff outside.
Your workflow. How has this affected the workflow that you've had in your practice?
Thanks. It really has. Here's the deal. If I wasn't utilizing Isolite and being short-staffed, our workflow would be way down. I mean, we wouldn't be getting done nearly what we need to do. There's a certain amount of dentistry that you have to do in a day in order to pay your bills and have enough money to take home to mama or to papa. You've got to go in there, and you've got your responsibilities. And if you're not doing enough production to meet your responsibilities, then everybody suffers. You can't pay your staff, you can't pay your rent, you can't put food on the table. So we need to produce a certain amount of income on a daily basis in order to make life happen and make life work. So with the Isolite, even though I'm short-staffed, I can still continue with the same patient load that I had before. We all work a little bit harder, but we can still maintain that high quality of dentistry that we need to maintain.
That is awesome. That is awesome. And then finally, your dental assistants. How do they feel about all of that?
My assistants love this because it frees her up. I mean, she's just free to do what she needs to do to keep the flow going. So honestly, when I start working, and I'll go in there and I'll do a procedure and not put the Isolite in somebody's mouth. I mean, I'm not just saying we got to use this on every single patient. But when I start to work without the Isolite, every single time my assistant says, aren't you going to use the Isolite? I say, no, we're just going to do this. And they said, no, get it out. because they're mandating that I use it because it makes their job easier and it makes their job better. They know that they're not leaning over, retracting, and doing everything that they need to do. It just makes life easier for the assistant. So I've coined the phrase over the years, and you've heard me say this before. The Isolite is not for me, it's for my assistant. The Isolite is the assistant's assistant.
Awesome. Well, first of all, thank you so much for joining us. Thank you for sharing those with us. Yeah, I love the videos that you have. Every time you do something, I learn something. I actually know way more than I did before, so I appreciate that. So,
oh, thank you so much.
So, hey, folks, if you like this content, please share it. If you have questions or you want us to cover other things on Dental Voice on the Case, please send those to us. Dr. Hirsch, have a wonderful weekend. Really appreciate you sharing it. And everyone, thanks for joining. Appreciate that.
Boy, we're coming right up on the 4th of July. So everybody have a great weekend, you guys. And just enjoy.